Assalamu alaikum wa rahmatullahi wa barakatuh. This is Abu Munir Ismail Davis, the CEO of National Zakah Foundation. And I have with me tonight two very, very important guests, Sister Mariam Ardati, who's a chaplain, amongst other things. And we also have Sister Nasreen Hanifi, who's a clinical director at Hayat House. Sister Nasreen is just coming on soon, inshallah. So in the meantime, we'd like to introduce Sister Mariam in relation to the topic tonight, which is about drugs and in our community. So NZF is trying to discuss and bring to the fore some of the subjects that generally is not spoken about and that people don't know much about. And it affects the welfare of our overall community. And in NZF's work, we see quite a few clients in relation to addiction to drugs, the effect it has on families, etc. So hence why we bring these subjects. So to start, we have Sister Nasreen Hanifi on now, and she's the clinical director at Hayat House. So we have Hayat House and Hayat Line, and we'll kind of explain tonight how that hangs together and how that works. Welcome, Sisters Nasreen. And tonight we're going to talk about the impact on individuals and families in relation to drug abuse. And maybe we can talk also a bit, explain to people what is it, what are some of the signs or the first signs that families can keep an eye out for to see if one of their family members is actually on drugs, and then we'll try and touch on how do they get help, etc., etc. So if we can just, if you want to introduce yourself a little bit in your background, Sister Nasreen, and then we can speak on that, inshallah.
Sure. So my name is Nasreen Hanifi. I am the president of Mission of Hope. I am also the clinical director for Hayat House. I am a psychologist by profession. And I've been working in the drug and alcohol sector for quite a number of years, specializing specifically in this sector.
Sister Mariam is one of the project managers that helped set up Hayat Line. And Sister Mariam, if you can give us a bit of background of how Hayat Line works, just briefly, and then we're going to go in a little bit more detail later in the details of how it hangs together.
So, Assalamu alaikum to the listeners. Hayat Line, so we have Hayat House, which is the drug and alcohol counselling service that runs under Mission of Hope. And one of the other Hayat projects is Hayat Line. So I came in to this project a little late in the piece just to give it an official launch, which alhamdulillah we did on the 10th of May 2020, which was this year. So it's gone live and it's been operational since May. And it essentially is a crisis line. It's a culturally appropriate crisis line for people in the Muslim community that may feel that they need some support through a personal crisis that they're experiencing. So there was some research done by Mission of Hope a number of years ago that looked into the willingness of the Muslim community to access crisis services. And the overwhelming response from that survey was that Muslims were more likely to access a crisis line if it was manned by people who were of the same cultural understanding and understood their values as well. So this is what we now have as Hayat Line, and people can call the 1300 number, which is 1300 993 398, and they can receive brief crisis counselling if they need that type of assistance and support.
That number is 1300 993 398?
Yes, that's the number, yeah. Hayat Line is operational at the moment, Monday to Friday, 9 till 5. But inshallah, the strategic plan is to have it rolled out nationally, and we already are receiving a good proportion of calls nationally right across Australia. So we've had some calls coming through from Perth, Victoria, Queensland. So the word is getting out. It's obviously a much needed, I would say, it's an essential service for the Muslim community, and it's just about building that capacity as we move forward.
All right. We'll go into a bit more details about the numbers later on, inshallah. So, Sister Nasreen, can you go through us an experience of from the start when families see the first signs of drug addiction, help, and how do families deal with that, and how do they get to you, And is it too late when they get to you, etc.? And then how do you deal with that?
So I think some of the first signs of addiction in general is it really depends on the type of drug that the person is using. So oftentimes if people end up using something like marijuana, then you can see those early signs. There's different stages of representation. So for example, sometimes the physiological responses or the physical responses will be very prominent. So things like dilated pupils, red eye, bloodshot red eyes, then the sweating, the constant talking, the walking up and down, constantly sleeping late, insomnia, and withdrawing themselves, depression, heightened levels of paranoia, anxiety. It really depends on the type of drug that the person uses that will have different effects. So usually for families, one of the things that I've always said to families is if you notice behaviors that are out of the ordinary, things that the person has never sort of done before in the past, and then you all of a sudden realize that this person is now, my child or, a family member, for example, is acting a bit strange, and they're saying the things that are really strange, then there's usually signs to look out for. And if they're isolating themselves, they're withdrawing, all of a sudden they change. Even changing groups of friends, can sometimes have an impact on people. So it really depends in terms of how people respond to the drug. It really depends on person to person, and on drug to drug. So every drug has a different representation of symptoms. Not all of them are the same.
So which drug these days would you say is the biggest problem, if there's such a thing?
In the Muslim community, there's a current shift in maybe the last 5 years where we've seen a bit of a rise in cocaine, and cocaine is one of probably the most expensive drugs in the market. Because for example, a gram of cocaine, you can get it in the market for about $250, $300. Really depends on where you're buying it from, which area, which suburb, and who's selling it to you. So if that's become a huge problem, particularly because cocaine is seen as a substance that's, related to VIP, so-called, it's like a VIP drug. So it's expensive, it's not readily available in the market. And so usually in the last, I think, 5 years, we've seen a huge increase in that. And marijuana is usually the most experimented drug that people usually try when they first start using drugs. I mean, there's always this misconception in our communities that people often use drugs as a purpose to sort of escape from their reality, but the research in this area suggests that at least 66% of people use drugs purely out of curiosity. So it's nothing to do with family backgrounds or anything like that. So there's a bit of some misconceptions and stigma around this in the community a lot. But majority of the time, I'd say at the moment there's a huge rise in cocaine and perhaps amphetamine-like drugs, so ecstasy and speed.
So if you're saying 66% of people use drugs just out of curiosity, like I read a statistics a while back about smoking, like it takes 1 or 2 cigarettes and then you're kind of hooked. With the drugs, is it similar, or do you have to use it a few times before you get addicted?
Drugs work a little bit different. I mean, narcotics is a little bit different as well. So what happens with drugs is that it usually is separated into 2 stages. So with addictions, we look at a tolerance stage and we look at a dependency stage. So oftentimes people who start using things like marijuana, yes, it's highly addictive, and then because they're searching for that first level of euphoria, which is the main reason why people use drugs, because when you're curious, you're using it, you're trying to experiment, seeing how the drug affects you. And then when you get that heightened level of, euphoria, what you end up doing is that you then start to experiment with other types of drugs, such as maybe cocaine, ice, and whatnot. So it really depends on the person, their physiological makeup. Clearly, if you're a male or a female, which usually has a huge impact on how the drug is going to affect you. And then on top of that, the amount of drug that you're going to use. So if you start off with just using marijuana, maybe once a week or twice a week, then your body starts to create some kind of a tolerance over a period of time. And then once that tolerance diminishes, then your body wants more. So your brain, the dopamine receptors in your brain starts to get activated, and then you have to end up using more and different types of drugs, and that usually creates some kind of a dependency.
So is it fair to say that there's not enough awareness about the impact of drugs if it's just about curiosity? Because if I was curious about something, but there's enough information out there to say this is like risky to do, or is it the peer pressure of the friends and the partying and stuff that gets people to go with this? And the second question is, you mentioned that cocaine is now prevalent. Is that because we are just have more money? People just have more money, and this is becoming the trend?
Maybe we need to ask the drug dealers that. I'm not sure if there's a trend. But look, to answer your first question, yes, really depends on. There's a lot of factors, why people use, but majority of the time, the research has always indicated that people use out of a form of escapism. So people who've experienced trauma, there's some kind of, for example, domestic violence inside the house, or peer pressure, then people usually end up using drugs, and then they use that as a form of escapism from their reality. But the current research in this particular area has a strong focus on, on curiosity. So the last statistics that came out probably in 2016 pretty much said that at least 66% of people use out of curiosity. So there is a lot of stigma around that, and there isn't enough awareness around these things, especially within our communities. There's lack of education around, people will experiment. Children, when you're 14, 15, 16, will experiment, and when you are then come from a family that is obviously very traumatized, a trauma family, or some kind of an issue that's happening in your life, you have a relationship breakdown, people will end up using drugs, and then that becomes then it turns into a process where you're using it now as a form of escapism. So you're more susceptible when you experience obviously difficulties in your life. And the second question, do we have enough? Is it about money? Look, really, cocaine is probably more. It really depends on the flavor of the flavor of the month. At the end of the day, I mean, if you look at the entire history of drugs in Australia back to the 1990s. There was a huge rise in heroin, and heroin was a huge issue in the Vietnamese community, and particularly in areas like, Cabramatta. That has sort of diminished over the years, and now there's this new flavor, which is cocaine. And clearly, with a lot of the younger brothers you see in our community, there's also the use of high levels of steroids. So it really depends on, it's the flavor of the month, whatever's available in the market. I don't know whether it's got anything to do with we have more money, that's why we can spend on cocaine. But at the moment, that's just showing that there's a bit of an increase in that market.
All right. While I give you some time to have a break, Sister Nasreen, Sister Mariam, the type of calls that you're receiving, if you see do you get calls where people are just calling up to say, look, I'm thinking about doing something, or are all the calls about people that have already satisfied their curiosity, so to speak?
So this is calls coming through to Hayat House or Hayat Line, because I'm across both projects. But if we're sticking to Hayat House...
If you but just take the time to explain the difference between a call that would come to Hayat House versus a call that would go to Hayat Line, so it's clear, because I think there's still some confusion as to how it all fits together.
Okay, so Hayat House has been operational for the last few years, and it centres around supporting those who are trying to get help for their substance use issue. And so that's a completely different number. It's 97095311, and that's the number people call specifically to access the drug and alcohol counselling service. Hayat Line, on the other hand, is what launched in May, and that's looking at crisis intervention. So if someone is experiencing suicidal thoughts, if someone feels that they're in a personal crisis and they can't talk to anyone nearby, they can't access a friend or a mentor, and they find themselves with no option, they can give the crisis line a call, and we're able to refer them on to a service that can provide them with the help and the support that they need. So they're two completely different projects. With regards to Hayat House, people that call Hayat House know they're calling a drug and alcohol counselling service. They're calling to access help specifically for substance abuse. So the calls that we're getting are across, issues with a number of different drugs. We're able to do a comprehensive intake for the clients, and then based on the results of that intake, either refer them on to a different service, whether it's for detox or inpatient rehabilitation, or whether it's for an appointment to see a counsellor here at the centre.
So, do you find that the actual people that use the drugs are the ones who call, or is it normally their families?
It's a combination of the two. We do see a lot of concerned families that contact the service because there's a loved one that's either gone MIA, or they know that they're struggling and they've actually finally said, look, I need help, but I don't know where to go. So we have had a lot of calls come through from family members. Sometimes families call not just because they have a loved one who's experiencing substance abuse, but because they are surprised or confused about what they're seeing in terms of symptoms. So this is very similar to what Nasreen was saying, where all of a sudden, this 19, 20-year-old, relatively stable university student is experiencing some very weird symptoms. They've experienced insomnia, or they're profusely sweating. They seem to be lethargic. They've gone into depression, and the family just can't make sense of what's going on. And this is one of the really unique aspects of Hayat House, is that we're able to bring those families in. This is with or without their loved one, and actually give them some education around what are those signs and symptoms of drug use, and what help is available to them. So it's not only the individual that we offer support for, it's the family as well. And we've seen some amazing results where people are feeling like their families have not understood what they're experiencing. People who've accessed the service, who may be drinking large amounts of alcohol on a regular basis, and whose family can't understand why they just can't stop. Why can't you just give it up tomorrow? They have no knowledge about the physiological effects of withdrawal if someone was to stop drinking alcohol, if they'd been previously consuming large amounts of it for long periods of time. So Hayat House is able to bring the family members in, give them some information about the effects of these drugs and the symptoms of withdrawal, and then they can then, even have a bit more empathy and compassion towards their loved one, and understand that it's not so easy to give up a drug just because you've realised that your life is falling apart. There's a process involved, and that's where Hayat House can help.
So if you walk us through quickly, if a family, so a parent comes in and they have concerns about their family member, and then you give them some guidance of bringing the family member with them. So now you're sitting there, the father, the mother, and the person, their child, and they're going through this process. And you give us an example of where, firstly, the child actually is happy to have the help, and then what happens there, and then you pass them on to the psychologist, and how that process goes. And then another example of where the child, or so the person addicted, is not really keen on getting help, and they sort of in denial.
So for the first scenario, we've had alhamdulillah some amazing, we had a more recent client of ours, without giving too much information, because we really do value the confidentiality and the privacy that we have, particularly because we're a small community and we do need to respect people's privacy. But just very generally speaking, we have had some young people experience issues with substance abuse, who literally would call and say, whose family members would call and say, look, we're losing them. We're losing him. His entire future is falling apart. We don't know what to do. So we've encouraged them to bring them in, and they can come in together if they're able to, and they have. We've had a mother and son come in where they were had to have a very honest discussion about exactly what's going on in their life and why it's not possible for them to give up their drug use as quickly as their family wants them to. So we were able to, the clinician that saw the family was able to walk through, the physiological effects of that drug, the side effects of it, what it looks like when you're on a high, what it looks like when you're coming off it. It doesn't necessarily normalize the experience, but it does give a name to what the families are experiencing, whereas otherwise they've had to hide away in shame and essentially isolate themselves because they didn't think anyone could understand what their child is going through. So we essentially created a safe space for them to have that discussion, to ask the questions that they wanted to ask. And alhamdulillah, that client ended up agreeing to move on to an inpatient rehabilitation service. And they've been able to come out of that service, re-engage with us. And the family have been, it just blown away by the fact that we were able to provide that assistance and support for their child.
Jazakallah khairan. So a question for you, Sister Nasreen. Thank you for the information. The Sister Sophia is asking, after the crisis, how easy it is for the affected person to engage for ongoing therapy and follow up?
Did you want me to answer that one?
Yep.
Look, it really, so oftentimes in crisis, when we do crisis intervention, it's very brief. So the clinician on the other line is trying to do 10, 15 minutes maximum of brief intervention to the person that's obviously affected with the crisis, and then we refer them on to the appropriate service. That brief intervention that we provide for 10 or 15 minutes, the entire process is to actually help the client to engage with ongoing services, particularly if we feel that the person is in some sort of a crisis that questions that they want. Sorry. So in that moment, so what we do is we spend that 15 minutes to just discuss appropriate services and referrals for them, and then some of the time the people who do call through the crisis line usually end up accessing services outside of that anyway.
How long does from the time you see somebody or that's come through the line and you see them for the first time, and they I guess it's the level of addiction. Let's say it's the, I don't know if there's an average thing, but let's say the person is addicted for a while. How long, if the person is going through the whole program, how long does it take for them to actually get better and get well and get off it?
Depends on how long they've used. So we always estimate the entire process on how long the client has been using up until the time that they come and see you in therapy. So, people don't use for 5 days and then seek assistance. People have been using for 5 years, for 10 years and for 15 years. So we're talking about 15 years of no therapy, and then they come into therapy, and then we have to sort of unpack that 15 years that they have been dependent on a particular drug. So usually in any particular setting, and that's the beauty about having a service like Hayat House, because we're not mainstream service, we're not similar to mainstream services where we only allocated a specific amount. And given that drug and alcohol, there's so many other issues and so many other comorbidities that usually arise from drug addiction that we don't limit ourselves to a specific number of interventions. We sort of see the client according to their need, and we base it on how often they may need therapy. So there have been moments where we've actually offered therapy twice a week, which has proven to be effective, and we deal with what is the presenting issue. So it really depends on the person, and I had people who've been addicted to alcohol, and it's taken us about 6 to 12 months for him to actually be abstinent. So we do work from a harm minimization approach. Our process is not that you need to come into our service and we need to stop straight away, because I think that's clinically that's not how we look at things. What we anticipate is that we do everything from a harm minimization approach. So you come into the sessions, we don't have an expectation that you're supposed to stop tomorrow. We have an expectation that it's a journey, and through that journey you will relapse, and then we will help you, along that road to reach abstinence.
A question just come up, which I was going to ask you. Firstly, before you answer that one, which is basically asking, is it for brothers and sisters? And the answer is no, yes, right?
Yes.
My question was actually going to be in percentage-wise, males versus females, for the ones you've seen.
There's clearly a huge amount of men that come and seek therapy as opposed to women, and for obvious reasons. Women in our community will not access a drug and alcohol service, not only because there's the stigma, there's the stereotype, there's the shame, embarrassment, and all of that comes into it. But a lot of the times these women don't have any extra support. How are they going to come and access therapy? So it becomes really difficult, whereas men have that freedom to come and access therapy. So a lot of the times we see more men, but I think, and Mariam can add to this, I think over the last maybe 6 or 12 months, we have seen a bit of a rise on women accessing services, which is fantastic, which is fantastic.
So do you find with the sisters you have to spend that first few sessions basically just getting over the worry about coming to the service and then get them into the real therapy?
It's the same with the brothers. So we
Okay.
don't do therapy anything different based on your gender. Therapy interventions are very treated. Everybody's treated in the same manner in the way we do interventions. Men also have the same issue. They carry that baggage that they carry for a very long time in terms of embarrassment and shame and guilt. They're the sole breadwinner of the family, and yet they're using drugs, or the embarrassment that they bring onto their family if they're young. So they come with all of those as well. So we have to unpack some of that and put the stigma and the stereotypes aside and focus on the actual problem at hand. And then during that entire process, then we sort of work with them on the shame and the embarrassment, and that usually happens obviously throughout each of those therapy sessions.
So what is meant by rehab? So what's the process of rehabilitation besides the psychological part? When they say I'm sending you to rehab, what does it actually mean?
In drug and alcohol, there's there's a 3-step process. So if a client obviously has a significant drug use and they haven't been able to go through a detox program, we don't usually recommend counselling in the first instance, because we like to work on the basis that the person needs to be drug-free for counselling to work. However, we don't have a Muslim, oriented rehab or a Muslim-oriented detox center. So what we try to do is we work with mainstream organizations to refer them on to a detox center first. So a lot of the local hospitals have detoxes attached to them, and those detoxes are usually for 5 to 7 days, where the person stays there with limited family contact. They have no drug access into the center. They work closely with the nurses, with the psychiatrists, and with the GPs, along with the psychologists. And then once they leave the service, then they enter. Then the recommendation part of their treatment plan is to go into a local rehab center. That rehab center usually lasts between 3 to 12 months. Really depends on the client and their presenting issues. And the process in that is that you focus on group therapy, individual therapy. You have a psychiatrist on hand, and you also have psychologists that work there as well with the nurses too.
So you touched on that point, and I know for many years we were talking about a Muslim rehab center, and there's a few organizations that's been talking about this and working on this. It's similar, to the community. So do you know if we closer to any of that, where we're going to have what we call a culturally appropriate rehab center?
I really hope so.
Do you know if
Not that I
anybody's
know of,
working
but
on that, or if anybody's like putting up their hand and say, let's do this?
um, Mariam, do you know?
Nope. So it's up for the taking. It's definitely something that again, we talk about essential services because, and with all due respect to the many new masajid that are currently being built and approved, we do need essential services for our community. One of them being a detox service, a culturally appropriate detox service, and I guess it's worth noting that the clinicians that work for Hayat House do take a clinical role. So they are qualified clinicians in this area. When we say we're culturally appropriate, yes, the staff are Muslim and they understand the values and the background and the lived experiences of the clients that we see. But we also are able to add that spiritual support by having a chaplain on site so that if they do want to explore their connection to Allah Azza wa Jal, they have someone that they can speak to at the service as well. And this would be brilliant if it could also, if we could also have a detox service that, for example, would have a prayer space where if they wanted to, pray or sit down and do their azkar or practice some mindfulness, they're able to do that in an Islamic environment. Where a lot of the clients that have come to Hayat House, having spent some time in some of these other facilities, have reported saying that they don't feel comfortable praying in the open or expressing their faith. And that's an integral part of the journey of so many people that are experiencing substance abuse. It may not be for everyone, but for those who do have that as a part of their journey, an important part of their journey, we need to have a facility that's able to cater to that.
So there's a question, Jeb, on detox. So before we go to that question, so this is a very, very important matter, and we've been talking about it for years as well, and hence why National Zakah Foundation, it's not our core business or anything like that, but we are trying to lift up some of the rocks that's been around for a long time. We're trying to lift them up to say, guys, we need to start thinking, as you said, we're building a lot of masjids, which is great. We're building a lot of centers, which is great, sports centers, which is great. But we're not, as a Muslim community, looking at some of the things that's causing our youngsters a lot of trouble. And there is no, in New South Wales at least, a Muslim rehab center. There's a sister on that's just mentioned, and we'll mention at the end about the facilities based in Melbourne. So your facilities are only based for New South Wales, right, at the moment? But people can come, I guess, from other states, but it's based in New South Wales. Now, the sister Manal saying that in Victoria, that the My Centre is looking at working on a Rehab Muslim Centre in Melbourne. And I think it's an important thing that for people who's working on this to reach out to them and see how we can, or whether Sister Manal can tell us how far they are with that. We can see, because it's very, very important. The question I was going to ask, and it's also coming up there, is relation to cost. Does Medicare cover any of this, or how much does it cost to do all or some of this?
It's actually a free service, so it's completely funded by the community, and it's for the community. So we work under that banner. All of our counselling services, including our case management, is completely free. So we don't charge for anything, not even under Medicare.
Does Medicare cover this? So if you would charge under Medicare to get income, you just choose not to do that, or it doesn't do that?
Well, Medicare has a specification rules in terms of who can charge under Medicare. So we hire clinicians. Some of our clinicians are not psychologists. So under Medicare, you can only charge if you're a psychologist or a social worker. So really, we could, but you're very limited with Medicare once again, with only 10 sessions per year. So psychologists only get 10 sessions per year to provide that service to them. So we're very limited in how much we can offer. So we prefer if we were just a service that catered freely to the community, and we could offer our services for, especially in counselling, for longer periods of time rather than 10 sessions only.
Can I just add to that? shameless plug that yes, this service is run for the community, by the community, but at the end of the day, we do have utilities that need to be paid. We have staff that need to be paid, and so the community up until now has been very generous with both Mission of Hope projects, Hayat House and Hayat Line. But just to give you an example, if a client was to access a rehab counselling service, a paid service, they'd be looking at a minimum of $100 an hour for a session. So for someone to attend twice a week for a month, not too good with maths, but we're looking at, $200 a week times 4, you're like $800 a month. And that's just to, enable people to cover costs. So Mission of Hope does rely on the generosity of the community to keep these projects going. So if people are looking to support these projects, then they can get onto the Mission of Hope website and click on the donate tab and help keep these essential services going for the community.
So the rehab services or the detox, and there's a question there about, can you explain what detox service means? They cost money, right? And I know that we had a client, that sister who needed help with funding for rehab, and we checked around, and one of the places that there's a very expensive place up north of New South Wales, and they charged $30,000 for a 4-week program. Unfortunately, she had private health that actually covered that. And so it's a very expensive exercise, and I think we need to talk about how we can get our own one up. So just to move on, sister, there's a question there. It says, could you specify what you mean by detox service?
A detox service is a service that's usually attached to the local hospitals in New South Wales. I'm pretty sure most states would have something very similar. And what that usually does is that people can refer themselves to that particular service, and they can stay on that program for 5 to 7 days. And the whole purpose of that is to get rid of the drugs from your system, because usually drugs last in your system between 5 to 7 days, but it depends on what you're using and how much you've used within that time period. So usually that's how the detox centers sort of work. If the detox centers are attached to the hospital and they're not private, you actually don't pay for attendance. But if it's private, then you do have to pay. And rehab centres, as far as I know, majority of them in New South Wales charge.
So there's another question there. What would you advise for brothers and sisters who want to seek help but too embarrassed or scared to reach out?
Look, I think the first thing I usually say is that, seeking counselling in any kind of service is very daunting, especially if you've never ever in your life, gone to seek some kind of therapy for your addiction. I always say that, if you feel that you're embarrassed or you're too scared, a phone call just to sort of have a chat to the clinician, see what it's like, and then to even have one session where you come and see the service and see the clinician, that's perfectly fine with us, so long as you feel less anxious about your experience, because we want your experience to be as effective, as efficient, and obviously as effective as possible. So we want to make sure that our service meets your needs. So if you have some concerns, or you're embarrassed, or obviously there's a lot of sisters that actually experience that, some brothers as well, because it's not something that our community really talks about a lot. So we always emphasize on the fact, okay, if that's the case, then just call the service, have a chat to our clinician, see what it's like. And I used to work in drug health services quite some time ago, and that's one of the recommendations we always used to give majority of our clients as well. If you feel a sense of anxiety over this, then just give the service a call, have a chat to a clinician. We can explain the process to you. Come for a visit, and at the end of the day, the decision is obviously entirely yours.
Sister Manali is mentioning there are public rehab places that are free, and we know that, and there's normally a big waiting list. And also we've got, these places are I mean, if you've got nowhere else to go and you need to go, that's where it is. But it's really, really important that we start planning and strategizing for a Muslim rehab center in New South Wales, at least. All right, now another question. Is there such a thing as a safe drug? You know how in New South Wales and Australia, they say they're going to test these drugs when people go to these music events. Is it let's test the drugs so that it can be safe? So isn't that a misleading message to people?
There's no such thing as a safe drug. The whole purpose of drugs is to actually give you a pleasure of some sort, so a euphoric feeling. So and there's no such thing as safety when it comes to that, because clearly when you're using a substance that releases huge amounts of dopamine into your system, you know, it can't be that safe, because so there isn't anything like that. The only thing that I am aware of, which I think is purely done for pain management purposes, is you know, hemp oil and marijuana oil, which has been trial and tested you know, extensively over different countries around the world, and they have worked significantly well. So other than that, I don't think there is no such thing as having a safe kind of a drug, especially you know, when you go to big parties like the one that you're talking about, brother Ismail. You know, those big parties are usually lots of ecstasy and speed, and you know, even if there was some kind of a safe drug that was developed, it really depends on the market. You know, these people create drugs themselves, they put it into packages themselves, so you don't really know exactly what's inside the drug. Some of my clients that I used to see at Hayat House, you would say to me, you know, well, I felt like I was using cocaine, but the effects was completely different. And then later on, they found out that there was a mixture of ice in that as well. So, you know, and nobody really knows what goes on inside, what actually is inside those drugs, even if they deem it safe.
That's actually a good point, Nasreen, because even through the intake line, we have had a number of clients call saying, this is, you know, I've used heroin multiple times, but I know what I took wasn't heroin. And it's not a coincidence that we've received a number of calls like that over the past couple of weeks. There's either a bad batch going around, you know, at the moment, and people are taking something that they didn't anticipate would feel or they'd react to like that. It's left them with an overwhelming craving for more, and because they don't know what it is that they used, they're trying to use any drug that's available to them to get that fix, and nothing seems to be working. So there are so many dangers taking these types of recreational drugs and illicit drugs. And of course, Nasreen can also talk about the fact that a lot of the clients that we're seeing are taking prescription drugs and addicted to prescription medication. And this is also something that we're seeing, you know, becoming an issue. And Nasreen, you could correct me if I'm wrong, but we're seeing this a lot in sisters, in women, you know, addicted to medications like tramadol for pain relief, or Valium. You know, it seems to be now normal. I remember when we were younger, you know, my mum would always check the parks to make sure there were no needles or syringes left. And the other day I stepped out onto a local park, and I stepped on an empty blister pack of Valium. So it's something that's becoming a problem. It may look safe because it's prescription, but before you know it, you realize you can't actually stop taking the drug. So the risk is there for both illicit street drugs and prescription medication.
And
Yes.
prescription medication can also be, you know, they can buy it off the market as well. So technically what you get from the doctor's surgery is not what you get from someone on the streets. So there's obviously a higher percentage that there are certain different other chemicals that are mixed to it. So you're not getting the Valium that you would get from your GP.
As Sister Manal mentioned there that, you know, prescription drug overdoses is exceeding the road toll now. And I guess if we look at the causes of prescription drug overdose is probably not the same as those for the recreation drugs, right? Because you said 66% is for curiosity, but one would guess that the other drugs, the prescription drugs, is more maybe there's a trauma, you had an operation and they started taking the painkillers, or they had some thing in their life that they needed to take some sleeping medication, etc. And then it just goes on and on from there. So that's where the doctors don't actually intervene quick enough, and so that's a different problem, right? So prescription overdose would be a different problem, right? Or addiction would be a different problem.
Majority of surgeries at the moment have a specific process put in place where GPs aren't allowed to prescribe addictive kind of drugs to their patients unless there's a need for it. So if there is some kind of an issue, a back problem or something like that, then they'll do it. But then there's different ways of how people go and get those prescription medications. So people usually lie, family members go and get it for them. They can get it off the streets, and majority of the time, prescription drugs can also be used as usually what happens, the process of someone using drugs like, say, for example, a stimulant like cocaine, which has a different effect on the brain. And then because to come down off cocaine takes about 12 hours. And then once that 12 hours is finished, then the person is feeling really groggy, horrible. So what they want to do is to calm themselves down because their body is getting agitated, they're anxious. So then they use, Xanax or Valium to calm themselves down. So really it goes hand in hand. And then there are some people who get completely addicted to prescription medication. It could be their mums that they've used, that they've tried once. It could be a family member that's offered it to them. So they're not really the ones that are getting it themselves.
So the clinics that they have where they do what do they call it? I know they've got one in Liverpool where they have an injection clinic, and you can go there and have an injection done. How does that work? Is that just to once again like the testing of the drugs to make sure they're safe, even though they know the people are going to take it, so they're trying to minimize death by taking bad drugs. So is the drug injection centers, does it work in the same way, and does it work? Does it help?
No, the drug injection centers are usually as a replacement kind of a therapy for people who are excessively abusing heroin and something like ice, for example. So what they usually do is they send them to outpatient clinics. That's what they're called. So these outpatient clinics help them to, substitute heroin for methadone, and then ice for Suboxone and naloxone treatment. So that's and to obviously monitor their urine, particularly if they've been involved in court cases. If they've been involved in the criminal justice system, then they need to have their urines checked. So these outpatient clinics actually help them to monitor that. The clinics where people actually get safe injection is called health services. I believe is attached to Liverpool Hospital at the back, and it's a centre where people can go and get needles. They can go and learn how to inject safely. There's every single hospital around New South Wales has a outpatient sort of a vending machine that allows them to get safe needles from there. So there's really a bit of a difference. So these health services are specifically to help people practice safe drug use.
Just on that note, I did start off, I think my first job out of uni was at an outpatient drug and alcohol centre down at in Southeast Sydney Area Health, and part of that centre was to send clinicians over to the supervised injecting rooms out at King's Cross, and they operated out of that harm minimisation framework. So usually these users were sharing needles, they were shooting up in alleyways, they were leaving the needles and syringes out in the street where they posed a harm to the public. So the logic behind them was, okay, they're going to use anyway. They're going to inject anyway. If we gave them a safe, medically supervised injecting room where they could come in and then safely use the drug, where they weren't posing a risk to either themselves or the general public, then that would fit in that harm minimization approach. And that those injecting rooms copped a lot of controversy. But what we did see is that the number of needles and syringes in streets, alleyways, parks dramatically reduced. Along with those services, there were exchange centres, needle exchange centres, and even outreach vans that would, do the rounds at night on a Friday, Saturday night and give out fit packs where people could exchange dirty needles for clean ones. And that, again, reduced the spread of HIV infections, hepatitis infections. So while it doesn't sound palatable to the general public, when we actually look at why these centres were established and what they did to reduce harm to the public, we start to understand that they're not as bad or as scary as what they seem.
And there's current research that actually suggests that Australia is probably the #1 country in the entire world that has the lowest hepatitis C rates, because of the way we've placed emphasis on the needle exchange clinics.
Interesting data. Moving back to some numbers or statistics, if you have any, in your experience or your now, whatever you think, what's the percentage of Muslims that are addicted to drugs?
Well, the National Drug Health Strategy Survey was conducted in 2016. In that particular drug strategy survey, there's no ethnicity mentioned or religion, for obvious reasons, because they sort of didn't want to include two of the most controversial areas for stats. But so there's nothing there that indicates that. But from research that I've done, because my master's thesis was on drug and alcohol in the Muslim community, I think in Australia you'd say about probably 1% of the Muslim population. And where we're sitting at 600, how many are we sitting? 600,000 Australia-wide as Muslims? Yeah, at least 1% of that population is addicted to drugs. And when you look at the ratios, 600,000 to 1%, it's still quite significant. And that data was in 2016, for example, the National Drug Strategy Survey. I think the next one is due either this year or the following year, to evaluate that in 4 years' time. But yeah.
In your thesis, did you identify also the percentage of drug suppliers in the Muslim community?
No, actually, I didn't explore that.
That would be risky, wouldn't it?
It wouldn't pass ethics, that's for sure.
Alhamdulillah. So we close to almost on an hour. So would you like to share one of your a story or a case that stands out, that's really a good example of how things made a difference, how your service made a difference?
Yes, I would, without disclosing too much information, obviously for confidentiality reasons. I had a client in 2018 who came to me. He was severely addicted to alcohol. And we sort of, he came in and he'd been using alcohol for about 7 years, non-stop. And his family didn't understand. So he used to own his own businesses, and he was afraid that he was going to lose, obviously, everything, his marriage, his children and whatnot. So what I actually did as a service, because our focus is usually on getting the family involved. I always feel as a clinician that, when families are involved in these type of settings, you can actually have better outcomes as opposed to only doing it one-on-one. We need to educate the family and raise awareness with the family at the same time. So I invited the wife into every single session. We had sessions for 6 months. and we implemented clinical interventions that worked well with him. And his focus was predominantly on focusing on, obviously, his spirituality. So we took that into consideration, and we developed a treatment plan for him for 6 months. And he was going extremely well. He actually abstained from using. So we used the harm minimization approach. So what we wanted to do was not stop the alcohol straight away. There's lots of misconceptions in our community that you should stop alcohol straight away. You can't stop alcohol straight away. That's just something we would never recommend, because the liver won't be able to tolerate that. So we usually say, let's just see how we can train our brain to use bit by bit rather than stop completely, because you will shock your liver. So we looked at it from a harm minimization approach, and alhamdulillah, with the grace of Allah, he was abstinent for about 6 months. He messaged me I think last year, and he said, I'm about to go to Hajj with my wife, and I just want to make dua for you and your family. I've been off drugs for about a year now, so I'm off alcohol for an entire year. I think that's rewarding as a clinician, but as a service, it's also very rewarding to be able to help someone who was in such desperate need.
That's great to hear. Sister Mariam, before we ask you the question, there's a question there about the masjids, and the brother's asking, how can the masjids work and the committees get in touch or work hard? What can masjid and the board members do to reach out to you or become an essential service? Do you think the masjids can play a role in this?
I definitely think that they can play a role in it if they can identify or learn to identify the difference between linking spirituality, we'll backtrack. I'll say linking a person's iman to their susceptibility to drug use, depression, mental health issues. If they can learn to, differentiate between the two, I think they would become an amazing community partner in tackling the issues that we're seeing now in our community. What I would love to see, and I'm going to put my chaplain hat on here, I'd love to see a lot less self-righteousness, a lot less judging. We don't really get very far when we level out moral judgments to people that are struggling with substance abuse. Having that, judge versus condemned dichotomy doesn't serve anyone. We need to show a lot more compassion. Islam has so much room to help people that are in need in this space without the judgments and the labels. And what I would suggest is a lot of the compassion and the empathy that I feel towards those struggling with substance abuse is that I can see the human side to them. There's so many layers to their struggle, including the stigma, including, the isolation and the shame attached to their particular fitna, their particular trial. Whereas if we look at them and with empathy, we can actually see some of our own struggles in them. We all struggle with some type of desire that we, or compulsion that we have to keep under control. There's, I think 6% of the population is now addicted to online shopping. There's so many of us that are, becoming addicted to, the acquisition of wealth or status or power. That's our weakness. But in these people, the weakness is substance use. So if we learn to look at people with a lot more compassion, and less judgment, I think as a community, we can help put these people in contact with the help that they need, as opposed to pushing them away and isolating them.
So do you think that there's an opportunity here that there should be some education and training to the shuyukh and the imams of the masjids or the boards of the different masjids? Is that something
Definitely,
that should do?
A huge opportunity, and I think people like Nasreen have been saying this for a while. And I can see that. I know with the Australian National Imams Council, they have moved in a really forward-thinking manner in getting some training for the imams around mental health first aid. I know you had a speaker here, not long ago talking about that. So I think there's definitely a willingness now, which is a breath of fresh air. So we are moving in that direction, and I think the more training that we can provide to imams to identify these issues and then refer people onto the appropriate services, the better it's going to be for everyone.
So before we close, and there's a sister from Melbourne that saying at my center, we'll put up the number for the contacts for the people in Victoria. It's at my center. Do you know of any services similar to, so there's the Melbourne one, the equivalent of Hayat House is My Center Support Services. The number is 907-83840. Jazakallah khair, Sister Manal. And in Brisbane, so somebody's asking, do you know of any support in Brisbane?
Nasreen?
I personally don't know any Muslim support services in Brisbane, unfortunately.
We are. I know that we are looking. We have contacted the Islamic Council of Queensland to look into assisting us to put together a database of services that we can refer people onto if they need to access those services. If they were to contact Hayat Line and need that type of help. So we're definitely working on consolidating a national database. So yeah, inshallah, we're getting there.
Alhamdulillah, there's a lot of great work happening in the community under the, like Annex doing a lot of work, the MRG, the Muslim Response Group, organizations like yourself, NZF, we're doing work around putting together collaboration with organizations across Australia to help with these things. So just in closing, Sister Mariam, you've opened since March on the call line, right?
Since May.
Since May.
Yeah,
So May,
May
just under a month, May 10th, yeah. So what would be the most interesting or call that you would have received in the last month? Or
probably the one that pulled at the heartstrings the most was the client who called because she was lonely, because she felt she couldn't talk to anyone. She sounded like, we do for data purposes capture age, so that we are able to kind of make use of that data for capacity building purposes. So this lady was aged in her 60s, and she just wanted to have a conversation with someone. She felt socially isolated, didn't have family visiting often, felt like she couldn't talk to anyone, and just wanted to have a chat, which of course we obliged her. And I think that, we are talking about creating a designated line or designated aspect of the service to make contact with elderly people who may not have regular contact with family members and may feel isolated, almost like a welfare check-in that we can do. So that's definitely on the cards for Hayat Line.
Alhamdulillah, there's a lot of great work happening there. And just in closing, a very, very big Jazakallah khairan to Sister Nasreen and Sister Mariam for your insight in this very, very important topic. And it's not just going to be a topic where we're just going to talk about and go away and nothing's going to happen. There's a lot of, we've got a lot of work and actions in the background that we're working on. Inshallah, we will keep the community up to date on what's happening in that space. But we really need to push the rehab issue, and we need to strategize. And even if we plan now, and I know it was about 5 years ago, I spoke to Danny about this, and until now we haven't done anything. So we need to plan and strategize, and maybe even if it's for 5 or 10 years, but at least it's going to go. It's going to, we might see it there. So thank you to all those who've tuned in, and Jazakallah khair. Next week, Wednesday night, we have another session, and it's a first world problem one. It's not about anything mental or drugs. It's about money. We're going to talk to Crescent Wealth and superannuation and why people should or shouldn't take out their money, and what's the zakah implications on your super in general. So as we say, these are some first world problems, but they are important things to cover off. Jazakallah khairan, Sister Nasreen, Sister Mariam, and to all of those who tuned in.
And thank you to NZF for once again being brave enough to have this discussion. So yeah, Jazakallah khair.
You're welcome. Wa yakum.
Jazakallah khair.
Assalamu alaikum.
Walaikum salam.